I came into a pharmacy one day. It was my shift to come in, and my partner was there, and he said, "Michelle, I got this strange prescription for an IUD. Can you take care of it?" And I was like, "Okay, sure." I've never seen a prescription for an IUD, but I thought I would just, take care of it. I got to looking, and I couldn't really find a way to order it, and I got through Cardinal, but I also knew this patient. And I knew she was pregnant, and she had gone through in vitro, and it was a big deal for her to be pregnant. So my heart sank because I thought something had gone bad, and maybe they were using the IUD to kind of take care of what had happened. So I finally figured out that we really couldn't get an IUD, and I decided to call the nurse. And I said, "I want to double check this prescription and see what you make sure this is what you wanted." She said, "Yes, we need this prescription for this IUD." And I said, "Well, this is not really anything we provide. I'll contact the patient." And I called her. It took me a little while to get up the nerve because I knew how bad she wanted this baby. And I called her and I was like, "Hey Mary, what's going on? I got this prescription." And she was like, "Michelle, I don't know what you're talking about." And I was like, "Well, I got a prescription for an IUD and I'm worried about, I know that you're pregnant and how happy you were about this baby." She said, "I'm supposed to have a prescription for a prenatal vitamin, not an IUD." And so I had called the office and the nurse had confirmed that it was supposed to be for an IUD, but she didn't check. And so fortunately I couldn't get an IUD, but what if it had been for something else? What if it had been for something that I could have gotten hold of and I could have given this patient? But it was an electronic prescription that they just picked the different line, and I had this prescription. And she was just like, "Michelle, thank you so much. I mean, this could have been really bad, but it's just supposed to be a prenatal vitamin." Pharmacists deserve provider recognition because they are often the first person that a patient comes to. They're also often the last person that a patient comes to after they've left an office, and they're readily accessible. So it just would be so awesome for them to be able to make those changes or make decisions right there. It's late hours often, we can't get up with providers. So many things can happen where we can't actually get up with the provider. And for us to be able to talk with that patient that we know and help make decisions would just be fabulous for us and the patient.